Hello, my name is Dr. Dewan S. Raja. Today I will discuss about Brown-Sequard Syndrome. The Brown-Sequard Syndrome is a syndrome caused by lateral hemisection of the spinal cord. In the spinal cord, we have the ascending pathway and descending pathway. The descending pathway, like that of the lateral corticospinal tract here, that extend from the cerebral cortex to the spinal cord. And we have also ascending pathway that extend from the spinal cord to the thalamus to the cerebral cortex. So Brown-Sequard syndrome is characterized by the following. We have ipsilateral, pyramidal or corticospinal deficits of the upper motor neuron lesion. Okay, that is the upper motor neuron lesion that extend from the cerebral cortex to the brainstem or to the spinal cord. Ipsilateral loss of the touch, vibration, and joint position sense due to damage to the posterior white column of the same side. Ipsilateral means same side. Contralateral means other side. We have contralateral loss of pain and temperature appreciation that begins 2 or 3 segments below the lesion due to damage to the cross-lateral spinothalamic tract on the same side. Okay, so our descending fibers like this corticospinal tract, they cross at the level of the lower part of the medulla oblongata. Okay, so we got that. Our spinothalamic tract, they cross at the level of the spinal cord and they cross obliquely, so they may go 2-3 level of spinal cord above in its crossing. Here we have also the descending pathway, that is the posterior column. They actually do not cross at spinal cord level, they cross at the level of the medulla oblongata. Here is the anterior corticospinal tract. This fiber do not cross at the medulla oblongata level. Anterior corticospinal tract, they cross at the level of destination, the lower part of the maybe at the level of the lower part of the spinal cord or the level of destination. They do not cross at the level of the medulla oblongata. They cross at the level of destination segment of the spinal cord. Okay, this is the simplest way of ascending pathway. We have the receptor, then posterior root ganglion with first order neuron. In the spinal cord, we have the neuron in the substantia gelatinosa, or we have the neuron present in the lower part of the medulla oblongata area, that is the nucleus gracilis, nucleus cuneatus. This is the second order neuron. From there, from the spinal cord or from the nucleus gracilis, nucleus cuneatus, we have the second order neuron. Okay, that should go to the thalamus, then to the sensory cortex of the cerebrum. So all sensation should go through the thalamus. Thalamus is the great sensory relay station. It receives all sensation except olfaction initially. Olfaction go to the cerebral cortex directly, but it has also connection to the thalamus. This is the descending pathway or motor pathway from the cerebral cortex. We can call it also the pyramidal pathway. Okay, the corticospinal pathway. It will decompose at the level of the lower part of the medulla oblongata, and it will go to the spinal cord here. Then we'll get the second and third order neuron here. Third order neuron will go to the muscle. Okay, so this is the simplest way of descending pathway. Second and third order neuron here is very close. Okay, this is the first order neuron in the descending pathway or motor pathway, ascending pathway or sensory pathway. Okay, we got that. Now we'll go to find out that ipsilateral loss of all sensation at the level of the lesion due to destruction of the posterior root here. total loss of all sensation. Here is total loss of all sensation. There will be hypotonic paralysis. Okay. Ipsilateral lower motor neuron sign, that is flaccid paralysis and muscle atrophy at the level of the lesion due to damage to the anterior gray column and nerve roots of the same segment. Same side lower motor neuron lesion. Ipsilateral. If the lesion occur above T1, thoracic segment 1, patient may present with Horner syndrome. Horner syndrome, we know that Horner syndrome has multiple components like ptosis, drooping of the eyelid, we have miosis, pupillary constriction, we have anhidrosis, one side of the affected side of the head and neck, there will be no sweating. Okay, there may be enophthalmos. That may happen with some type of lung cancer, maybe some type of head injury. We'll get Horner syndrome. If the lesion occur above T1 segment of spinal cord, this will cause disruption of the sympathetic innervation to the head and neck, and we'll get Horner syndrome along with Brown-Sequard syndrome. So if you look at the image again, lesion site is the site of lesion. Here total loss of all sensation. The same side, loss of tactile discrimination, vibratory and proprioceptive sensation. There will be spastic paralysis. Okay, there will be spastic paralysis. And on the other side, we'll get loss of pain, temperature sensation, impaired tactile sense. This is 2 or 3 segments below the level of lesion. Okay. Brown-Sequard syndrome, how it is caused? Is caused by fracture, dislocation of the vertebral column, bullet injury, stab injury, or by an expanding tumor. When Brown-Sequard syndrome develops? Brown-Sequard syndrome develops after a period of spinal shock. Fibers of the dorsal column remains ipsilateral to the brain stem. Fibers of dorsal column means that fibers of the fasciculus gracilis, fasciculus cuneatus. They will remain ipsilateral to the brainstem at the middle oblongata. They will also cross. Fibers in the spinothalamic tract synapse and cross within 1 or 2 spinal levels, then travel contralaterally, and that travel is oblique. So several segments may be above the route of entry at the level of entry of the first order neuron, but the crossing and ultimately destination to the other side may be several segments above. Sometimes even a few segments below is also possible. Okay, so spinothalamic tract synapses and cross within 1 or 2 spinal level, then travel contralaterally obliquely. And that's all about the Brown-Sequard syndrome. If you have any question, please feel free to ask me. Please share the information with your friends. And please support my channel. Please subscribe me. Have a nice day. Bye now.